Because knee pain is such a common problem for so many people, we felt it was important to take time and make a little video showing you 3 things you need to take a look at to figure out why you have knee pain, and also provide some suggestions of things you can do to take care of it. The first thing you're going to want to look at is your ankle mobility, specifically how much can you dorsiflex at your talocrural joint. So what this means is how far can your knee travel forward over your toe. A simple way to check this is by going into a half kneel position and placing your foot about 4 inches from a wall. You don't need to use a ruler, you can just use your fist to estimate about 4 inches. I'm just going to use this dowel for the sake of this video. So, keeping my foot flat on the ground, I want to push my knee forward as far as I can without my heel coming up. As soon as my heel starts to lift, that's as far as I get to go. And right now, that's about it for me today. My ankles are a little tight, been doing a lot of running and especially sprints, so this is something I need to work on. If you take your shoes off, you'll probably see an even more glaring deficit. So make sure if you have shoes on, they're the shoes you would be running or training in. The second thing you are going to want to look at is your movement patterns, or your relative knee control when you're doing exercises such as squats, single leg squats, lunges. You need to assess how you are able to coordinate your lower extremity kinetic chain. So a good way to do that would be by standing in front of a mirror or even videotaping yourself with your cell phone and just taking a look at your single leg squat and see what that looks like. Bear with me, it's 6 in the morning here and I'm still out of sorts. But taking a quick demo and using that to look at yourself to kind of take an analysis of how your knee moves. So the things you're going to want to be looking at are 3 planes of motion. So sagittal plane, front to back, frontal plane, side to side, and transverse, rotational. So from a sagittal plane standpoint, front to back, what we're going to want to look at is how far forward your knee travels relative to the rest of your foot, and also how far back your hip goes. A simple way to do this would be by drawing lines from your ankle to your knee and another line from your hip to your shoulder. Using this dowel to show those lines, if I have one line or segment traveling from my ankle to my knee, that line should be parallel to my shoulder and my hip. If these lines are not parallel, we're not evenly distributing the stress in between our hip and our knee. So that's the first thing you want to look at. The only other thing you're going to want to look at in the sagittal plane is the pressure you feel in your foot. If you have too much pressure coming onto your toes of your foot when you're doing a squat, and this is what it looks like, that is not correct. We want that pressure evenly distributed throughout your entire foot. If anything, maybe a little bit more on your heel. I tell all my clients you want 3 big points of contact, one being your heel, ball of your foot, you need to be able to feel your arch, and also the base of your pinky toe. So if you had a little tripod there, that's what you want to feel. In terms of frontal and transverse plane motion, as you're dropping into your squat, we want to compare where your knee travels relative to the second toe of your foot. Why the second toe? That's the longitudinal axis of your foot. So as you drop into your squat, is your knee moving inside that second toe? If so, we are creating a valgus moment at your knee. It doesn't take a trained professional to take a look at that position and say, that doesn't look right, or that's probably not a good position for your knee to be in. So as you're going down, where does your knee travel relative to your second toe? Is it dropping inside of it? Is it straight over top? Or am I going too far out into varus? We don't really want to be inside that second toe at all. A little outside of it's okay. We definitely don't want a ton of wobbling though. So take a look at that. The other thing we need to check in the transverse plane is what are your hips doing? So as you're dropping into your squat, is your pelvis opening up and are you rotating? So what we kind of call a corkscrew or an over rotation, but I'm essentially opening up my hips here. This is not an optimal position to help engage my glutes and stabilize my pelvis. So pay attention to the way your pelvis is rotating as you drop into that squat. In the transverse plane, you also want to assess hip and thoracic rotation. So if you stand with your feet together, Arms out to the side. Again, you can use a mirror or record yourself with your cell phone, but you want to see how far you can rotate each way. What you want to see is your belt buckle or your belly button be able to assume 45 degrees each way. Your arms should be able to pass and clear behind you. So as I come back, you should see your arm come around the other side or kind of pass through 180 degrees. The reason why this is important is if you're a rotational athlete, such as a golfer, a baseball player, tennis player, hockey, and you do not have enough rotational abilities through your hips and your T-spine, that rotation can get transmitted down through your femur into your knee and cause a rotational shearing stress at the knee joint. This can place a lot of stress on the meniscus, and that's definitely something you don't want to do. So make sure you check this out as well. An area I find a lot of people do not address before they come to see me when they have knee pain is their running technique and their jumping technique. If you are a running athlete, you need to make sure you take a look at your running mechanics and you clean those out before you waste time and money coming and working with a professional such as myself. If your running technique is not where it's supposed to be, I don't care how much corrective exercise you do, you're going to continue to overstress the tissue and overstress your knee, and you're just going to get frustrated with the fact you're not making progress. This same can be said for your jumping mechanics. So if you're a volleyball player, a basketball player, or some other athlete that does a ton of jumping and you're having knee pain, you need to take a look at your jumping mechanics and make sure those are sound before we start getting into all this corrective exercise stuff. So now you have some ideas of how to do a quick self-assessment of your knee. You get an answer and then you're like, great, now what do I do? Thanks a lot, Ryan. I know what's wrong with my knee. How do I fix that? If you are somebody who, when they drop into their squat, is coming really far forward onto their toes, there's one of two things happening. One, you have fantastic ankle mobility, which you are a rarity and I'm jealous of you. Your fix will be quite simple. It's learning to sit your hip back and feel your heel as you drop into a squat or lunge. Most people, if you have limited ankle mobility and as you do a squat, your heel is lifting off the ground, we need to start by fixing your ankle mobility, and then we still have to teach you how to sit back and properly coordinate your glute and hip muscles. If you saw in your video, your little self-analysis, your knee is wobbling in or all over the place, which it might be some combination of this or too far forward, you need to learn how to properly coordinate your hip external rotators and your abductors. This same can be said if you found yourself corkscrewing during your single leg squat. You can check out our video on glute activation. I'm not exactly sure what the title is, but I know there's booty work in there somewhere. That would be a good video to check out to learn some different exercises. The biggest thing with this is not necessarily getting your hip stronger as much as it is learning how to coordinate your body movements together. So proper lumbopelvic stabilization with activation of your TA and internal obliques in conjunction with your glutes, okay? So it's a combination of some strengthening, but more so learning how to coordinate those fibers. If you found during your assessment you have limited ankle mobility, we have a video for you. Check out our ankle mobility. If you have tight hips, there's also a hip mobility one, or a tight T-spine, you can also check out our T-spine mobility. If you are not sure what correct running mechanics should be, you need to get with a trained professional who can help coach you through that. That can be someone such as myself, so a sports PT, my wife being a strength conditioning professional, somebody who has a lot of experience with running mechanics, coaching them, and knows what it's supposed to look like. The same can be said for your jumping mechanics. You need to get with somebody who understands how the body is supposed to move and distribute force and energy as you're jumping and landing. If you're not sure what that's supposed to look like, you need to get with a trained professional who can help you with that.